Hello everyone and welcome to this webinar. I'm so excited to have you all here today. My name is Mats Andersson and I'm the Executive Director of the Swedish American Chamber here in San Francisco, Silicon Valley. So we are a member-based organization and we try to help our members to do business here in the Bay Area. And we are part of a larger network, which is the Swedish American Chambers in the US. We have 20 plus regional chambers. And I think important to emphasize here that we are a non-governmental organization and that we receive no tax money from anyone. And so the background to this webinar, it came from many of our members reached out to us and during the summer, and they said the Swedish business partners here in the US, when they were discussing with their American counterparts, they had to defend or discuss or defend the Swedish handling of the coronavirus and instead of doing business. And we thought what we can do to help them out. And so we reached out to Dr. Anders Tegnell. I think he's the best to answer this. And so we can get the answer directly from him and we could discuss around this. So we're thankful to have Anders here. I think he need no further presentation. For the Swedish people in the audience, you know him well. For all the others, you could say he's the Dr. Fauci of Sweden. And I think the formal title is Deputy Director of the Swedish Health Agency and Chief or State Epidemiologist since 2013. And also in the panel, we have Lars Johansson. Lars, do you wanna say a word?
Thank you, Mats. Very nice to be with you. My name is Lars Johansson, born a Swede. I grew up outside beautiful Uppsala. I came here 30 years ago. I've been practicing corporate law for a little bit over 20 years. These days, I'm a part of Burks Johansson LLP, which is a cross-border boutique law firm. I'm also a member of the SACC board.
And we have Saga Fristedt joining in from Sweden. She's our responsible for events and membership services. Saga.
Thank you, Mats, and hi, everyone. I just want to say that we got a lot of reactions and comments about this webinar. It is great to see you all so engaged, and there are definitely many opinions about whether the Swedish strategy is a good or bad one. However, as an organization, we are trying to stay neutral in this discussion, and we're hosting this webinar with the purpose of creating a platform and opportunity for a discussion with different perspectives.
So let's dive into it. We have Dr. Tegnell is with us from a train in Sweden, but hopefully they have a good Wi-Fi there and it works fine. So let's start by rewinding the tape a little bit. So if we go back to in January, we know that there is a virus coming from China. Nobody really knows how bad it is or how it will hit the world. But directly there's several Asian countries that do a very strict lockdown. I think, for example, Vietnam, I think they closed their borders around mid-January. And also I think Singapore and South Korea, they were very fast in implementing kind of strict measures. But in the Western world, we were kind of not taking it that seriously. I think Dr. Fauci said end of January that it's unlikely that it will really have a big impact on the US. And you seemed, even in February, not to be that concerned for the impact on Sweden. And what happened exactly there?
Yeah, as you said, there was the signals from China fairly early on. On the other hand, you also have to remember that this was not the first time we heard things about new viruses from China. And the Chinese so far had been very good at stopping them at the root, and there was never any extensive spread from them. And in the beginning, the story that was told sounded very much like this was a big spread from one of the live markets in China, and that this was mainly a spread from animals to humans, and not so much a spread between humans.
I think one of the main problems in Sweden seems to have been all these people who went on the winter ski holidays. With what you know now, regardless of lockdown strategies, would you have restricted kind of implemented kind of restrictive travels out of recommendation for the winter holidays? I mean, obviously, probably you would, but why didn't we do that?
I think we need to realize that what happened in Sweden did not really come from the Alps. When we looked at the virus afterwards, we have seen that it came from many other places, among them the US. So the viruses that eventually took over in Sweden were not the Italian virus. That we contained by having very good communication with the people coming from Italy, and they sought healthcare, and those transmissions were stopped. So the viruses that were eventually established in Sweden, there were viruses from the UK, from the US, and partly also from Austria, but not from Italy. We have also to remember that Italy had very strict travel restrictions, and in spite of that, they got a huge introduction of the virus. But what we didn't know, and what the countries themselves didn't know, was the extent of the spread in all over Europe at that time. So the hundreds of thousands of people traveling from Sweden to different parts of Europe during that time, many of them took it back to Stockholm and the surrounding region. And once it took off there, it was really not possible to stop it anymore.
You said in your summer program in the Swedish radio that you had an agreement when you came to this point that you can't stop it, but you need to just manage it, that you had a 20-year kind of discussions with European counterparts on how to act in these situations. And then you said suddenly the world went crazy overnight. And what exactly happened there? And how do we know that it wasn't Sweden who went crazy because everyone else was doing something different?
We don't know. I mean, I think we all need to realize that who did the best things in the end will take us a year or two, even longer to realize.
Maybe Lars, we hand over to you if you have a question.
Yeah, sure. Thank you, Mats. And I'd like to begin by thanking you, Dr. Tegnell, for being with us today, taking the time, and also to thank you for your long public service. I think these are the contributions that add value and add to the image and the goodwill that helps us Swede in the world, paves the way. On behalf of the board, I also would like to express and say that our hearts go out to everyone who has been impacted by the virus, who has lost someone or seen someone suffering from the virus or from the economic hardship. I mean, these are terrible times. But here's my first question, and in your words, could you give us a sense for all the things that went into when you started coming up with a plan, all the factors you considered, maybe not all, but the material factors, and how you balance them against one another? Was this a culture, a value-based evaluation? Were you subject to political or ethical guidelines?
I think we need to realize that what we're trying to do in Sweden is basically the same that we're trying to do all over the world. And that's to slow down the spread of the virus as much as possible, to make it possible for our healthcare systems and for our social services system and for our society as a whole to continue to function as well as possible. And then we have used different methods and different tools to do that. And I think when you look at what we've done in Sweden, we have very much followed our Communicable Disease Act and other basic laws and traditions in Sweden, that we worked very much with the population, giving a lot of responsibility to the individuals and giving a lot of mandate to the individual to, in their own situation, find the best solutions to achieve the goals of social distancing, slowing down the spread and so on. So basically, we're not trying to do anything else than anybody else. And we are definitely not, at least from the Public Health Agency, we are not really looking at the economical effects on this. That is not within our mandate. We are looking at the broad issue of public health. And that's why, for example, we decided not to close the schools, because we know from a broad thinking about public health that closing schools have huge effects on the children. When you think about their health, both in the present and in the future. So I think it's those kind of thinkings that really led us to where we were going, how important it is to think about public health in the broad perspective and not just concentrating on stopping the disease as much as possible.
When you debate with yourself, or when you question your way forward to the right answers, what are the issues that you debate with yourself or that you question? Which ones are the most difficult when you try to come up with a way to mobilize society?
I think it's very much, I mean, one thing is the question about equity, because we know that public health even in Sweden is very unequal. And how do we then reach these part of the population that are socioeconomically less favored and will suffer more from any kind of decision and any kind of disease we have? How can we also protect them in a reasonable manner? And how do we develop our recommendations and rules not to hurt them more than we're hurting everybody else? And I think that's very relevant in the US, and it's also very relevant in Sweden. This disease, as many diseases, have shown us that the poor parts, the socioeconomically less favored parts of the population has been more severely hit, both by the disease itself, but also by the regulations and recommendations we put in place. And how do we accommodate for that, not to create more inequity than we already have in place?
Yeah, maybe over to Saga. Any questions here from the audience?
Yeah, we got a lot of questions. I would just like to start to ask a question from Cecilia Berlin, who is Secretary General of Swedes Worldwide, also called Svenskar i Världen, an organization supporting all 660,000 Swedes living abroad. So they would like to ask, where does the public health agency's responsibility end? Do you have a responsibility for informing Swedish citizens living abroad about COVID-19 as well? Or do you only have responsibility for Swedes living in Sweden?
No, our basic responsibility is really to coordinate the work about public health in Sweden. Sweden, when it comes to public health, is a very federal system, and the actual responsibility to sort of implement public health is with the Swedish regions and with the Swedish communities. And we do not have a direct responsibility for Swedes living outside of Sweden, but of course we will, wherever we can, also work in that.
Did you ever discuss with our neighboring countries like Norway, Denmark, and Finland about how to best strategize in a unified fashion so virus would not spread across the borders, like when returning citizens and tourists?
Yeah, we have a lot of discussions like that, and we have a very close collaboration with our Nordic neighbors we had for a long time. This time it's proven more difficult than others because this has also become a very political issue. So the direct technical collaboration has not been as easy as it usually is. But we have regular meetings, we talk to each other every week, and we really do our best to minimize the effects and also to understand what's the background behind that we act in this situation slightly different in the different Nordic countries so that we have an understanding on why this is happening.
I was just wondering here, since Denmark, Finland, and Norway and Iceland are all culturally pretty similar to Sweden, why has there been such a backlash for those countries to the way Sweden has dealt with the pandemic?
I think we need to realize that maybe we're not as similar as we think in these countries. I mean, in many ways, the greatest similarities when it comes to structures and so on are between Sweden and Finland. We have the societies, the legal system, the administrative system are very much similar. But when it comes to population, the Swedish population looks, with this big influx from migrants and so on, we look a lot more like Belgium or Netherlands, or maybe even the UK. And when it comes to the density of population in our densely populated areas, I mean, the Stockholm area is also rather unique in the Nordic region. So I think we are a little bit stuck with comparing us to our Nordic neighbors, which I don't think is completely fair when it comes to the development of the pandemics, because the situation is different in Sweden than in our Scandinavian neighbors. And also we have to remember that the influx in Sweden was disproportionate if you compare to the other countries. We have a huge travel from Stockholm and the region around Stockholm during a very critical week in the European pandemic. And I think when we look back at this, and we are trying to look at it now and get some kind of science behind that, but our feeling is that the number of people that really were coming into Sweden during a very, very short time was much, much bigger than in the other countries. And that was the reason that especially the Stockholm region was overwhelmed by the number of cases at an early stage, and the possibilities to work with it like they did in the other Nordic countries with testing and contact tracing and so on. just disappeared because there was just not enough resources to do that. And then we needed to move back to our second level of defense, and that was really mitigation and trying to keep our healthcare running and provide resources for that, and prioritize resources for running our healthcare. And that was extremely well done. The Swedish healthcare kept on running, provided good quality healthcare for everybody who needed it, and transformed healthcare in a way that I think is fantastic. I mean, there was always ICU places empty. At least 20% of all ICU places at any given time were empty. And there was a development, they doubled the amount of ICU capacity in Sweden within a few weeks. And that was, to a certain extent, of course, done because there was not done a lot of contact tracing, a lot of testing, and a lot of other things that could have been done instead. So it was a choice that needed to be done, to be made. And that was made by the Stockholm region and the surrounding regions. And I think it was a good choice, because otherwise we would not have a healthcare system that worked as well as it did.
Another question that we have got a lot of questions about is regarding face masks. First of all, why is it not recommended to wear a face mask in Sweden?
We need to realize that face masks are excellent tools in healthcare, excellent tools in the care of the elderly, where they have been tried out, and we have a long tradition and very strong evidence of how important they are. But when we come to face used in the public, the evidence is very low, and there might be some kind of effect. There can be an additional tool, both what the World Organization said, when you have done everything else to stop crowding and to make it possible for people to keep distance. So far in Sweden, we've been able to implement that without face masks. And we have, during the summer, have a rapid fall in the number of cases. So the pressure in Sweden to also add face masks to what we're already doing is very small at this stage. We are definitely following the development, and if we get the resurgence in Sweden, or if there becomes new proof about face masks being very important in certain settings, we will definitely use them. But at this stage, there is really no evidence of that they would add very much to what we're doing in Sweden right now. And also the science tells us that keeping a social distance is a much stronger and much more efficient tool than face masks. And there is always the fear that if you put on a face mask, you will not think about social distancing anymore. And then you will definitely have a worse situation than we have today. So that's why we so far have seen that, yes, there might be a role for face masks also in Sweden, but the role is not right now. It might come in the future.
So what you're saying is that you believe that that the face mask can provide like a false sense of security, and people might be less cautious then?
Yeah, that's definitely what, and also what we get a lot of, I mean, there's unfortunately very little science also behind that, but at least we do get a fair amount of reports from Swedes living in other countries. That's how they see the situation developing. And when we have a favorable situation in Sweden with falling numbers of cases and so on, we believe it's better to save face masks for a situation where we really need them and not use them now when all the numbers are going the right way with the things we already have in place.
Yeah, because regardless of whether there is evidence or not for the protection of a face mask, and in what sense, don't you think they could remind people about the virus in Sweden, because it's not as present as in other countries, because you can see like very clearly that something is different from old normal, and rather make people like more cautious because they see someone with a mask and might think like, oh, they might be sick. I should maybe be more cautious and take more distant. Are there any studies on the fact that people might be less cautious, or where is that idea coming from?
No, there's no studies on people becoming less cautious, but there is no studies about people becoming more cautious either. So the judge or the jury is definitely out on that issue still. The only thing we have is people telling us stories from different countries, which goes in different directions. So it's very difficult to know. What we do know from studies in Sweden when we ask people is that, as I said, 80-90% of the Swedish population are very well aware about the virus and are also very well aware of the need to keep social distance. So I don't think that kind of a reminder is really needed in Sweden either at this stage.
I read an article about the Spanish flu here in San Francisco 100 years ago, and it was exactly the same debate around the face mask then. So they jailed people without face mask and really stigmatized them. And how can it be that the science has not evolved in 100 years on this? It sounds incredible.
Yeah, no, I completely agree. And that's why I think it's so fascinating that we are now all over the world running after face masks when the science is still not there. And unfortunately, it doesn't really look like there's a lot of good studies being done right now either. I don't know. This is, I agree completely. Now when it's starting to be used in so many different countries, why don't we see a lot of studies coming out on that? Why don't we see a lot of studies on the effects coming out? There's very scant. I mean, in the bigger review that was done in the Lancet, one of the major scientific magazines on this, they could only find 3 studies on face mask in the public.
So you were saying before that mask might not be the next recommendation depending on where everything goes, but what would you say are the next steps to ensure safety?
I think what we're looking to now in the fall is that we probably won't have another big wave like we had in the spring. We think that's very unlikely. Instead, we're going to have a lot of local outbreaks. And those, I think the main tool to limit those is really contact tracing, testing of a lot of individuals, and being very observant of the start of outbreaks. And I think that's going to be in our main tools to start with, to try to stop them. If we need to do more things, if we need to close down things like public transport, if we need to also use face masks and so on, of course we will do that. But on the first level of defense, the first borders of defense will really be contact tracing and testing and using those traditional tools in limiting outbreaks.
I think it's difficult to speak about this subject without talking about all the elder and how many elder people died. And I listened to your summer program that you took care of elders in the 80s. You worked on this kind of not the best environments to be, and then you said you came in contact with someone who was barber or something, who was emphasizing that you treat care of elders at home. So were you thinking specifically with your background of working with this in the beginning of the pandemic on how to help the elders, or was it just like randomly that? And what happened exactly with the elders, and how did we miss out on that so much?
I think, like our state minister said, that this pandemic has shown weaknesses in our system. And one of the huge weaknesses it really exposed was the quality of care in our long-term care facilities, in our elderly homes. And that this is something that happened like 20, 25, 30 years ago. The ädelreform is called in Swedish. When the long-term care was moved from the hospital systems into the community social care systems. And this was done with very good intention, had a very lot of good aspects of it. But in repeated reviews of that ever since then, it has been shown that the medical part of the long-term care facilities, that expertise and that the knowledge about that in the long-term care was not really up to standards. And many of the long-term care facilities manage this very well anyway. But I think what we have realized that many of the long-term, at least some of the long-term care facilities, need to have more medical resources, more medical expertise. And that was what was lacking now. And that's why it took some time for these long-term care facilities to really live up to the needs that became apparent during this time. And now they are working excellently. The amount of people being infected in long-term care facilities is almost down to 0, in spite of us still having a fair amount of spread in the society. The number of deaths in the long-term care facilities also fallen enormously. I think in Stockholm it's been 2 weeks without one single case of somebody dying in the long-term care facilities from COVID-19. So there's been an enormous improvement. But of course, it would have been nice if this improvement had been done earlier on in the pandemic. But as many of us realized, this was a weakness we had in our system. It was exposed in a drastic way and costed Swedish society a lot of deaths. And that's extremely unfortunate. And I really hope that one of the big lessons we'll take with us out of this pandemic is how important it is to keep a good quality of care in these long-term care facilities, not only on the sort of social level, but also on the medical level. And you can really balance the two of them if you have enough resources in place.
On the other side of the age spectrum, we get a lot of questions regarding schools open. So in the issue of school openings is a big topic in the US. Are you seeing any early data on infections associated with the recent school openings in Sweden, either among students or teachers? And if so, are any changes in school operations being recommended?
No, I think we have made a review of the effects of keeping the schools open together with our Finnish neighbors who closed the schools, and we can find no ill effects of keeping the schools open. We have not more severe cases among children in Sweden than they had in Finland. If you sort of equalize everything else around it, the spread of the disease and so on. We can see that in Sweden, the teachers have a lower risk of getting severely in COVID-19 than almost any other profession we're looking at. So there is a lot of evidence, signals that keeping schools open is not dangerous, neither for the children, nor for the teachers, nor for society. At least not in the Swedish or the Finnish setting. What it's like in the rest of the world is difficult to know. But so we feel quite confident that keeping schools open carries very, very low level of risk, and closing schools carries big risks of creating problems in health for the children. So we are quite happy about that. We kept the schools open, and I think we definitely will stay with that. Of course, there might be a situation where you have a local outbreak or something like that, and then closing a school might be one of the things that needs to be done, but not so far. And we have had, during the spring, when we had the schools open, we had, I think, 1 or 2 outbreaks in schools, and that was outbreaks among teachers, not among the children. Teachers spreading the disease between themselves in coffee breaks or whatever, we don't really know. So I know that there are stories and studies from other countries that show slightly different scenarios, but I think that experience from Sweden and from Finland, and I would also say that most countries in Europe share this opinion now, and one of the first things that most countries do when opening up their society is opening up the schools.
You mentioned that outbreaks in schools were in teachers and not in children, but since the children are often asymptomatic, how would you know that then? Could the school be a driver for community infection via the children?
No, yes, that's true, and that's often the criticism. It has been, in Finland, they have very thoroughly investigated 1 or 2 of their outbreaks, found no signs of disease among children. We have looked at children, how often they are infected, by looking at the antibodies in children, comparing them to adults, and children have less antibodies than to antibodies. Another sign that children are not the drivers in the community. There's incredibly good studies from Iceland showing that when they've been contact tracing, they can see that children very rarely, if ever, infect adults, but adults infect children.
You're responsible for public health, and some of your European colleagues at least are responsible more for the disease. And you said, well, I think in an interview, that if you had been solely responsible for handling the disease, you might have acted differently. I think I read that in a Swedish newspaper, and it's kind of interesting because that could have maybe driven some of the different reactions and actions. Is that correct understanding?
Yeah, I think so. I think, and this is a debate we'll probably have in the future, to think about a bit wider thinking around public health when we talk about this kind of crisis than focusing solely on stopping a certain disease. You're also thinking about the effects of the measures we put in place. I think it's really become really important during this crisis. It's been shown before. I mean, during the SARS crisis, exactly the same thing came up because all the measures that were taken during the SARS crisis damaged economies all over the world to a great extent. And when we looked back at that afterwards, there was a clear agreement that many of the things during the SARS crisis were unnecessary and damaged economies and damaged public health in many ways that was not very useful. And I think when we look back at this, we might end up with the same kind of conclusions. And I think then that's why it's very important to keep in your head all the time that the things you do should not damage more than they help.
We're bumping up here on time soon. Saga, you want to jump in with some last questions from the audience?
I would like to finish off with a question that is probably pretty different from other questions that you had before. And that is, what is a question that you always wanted someone to ask you?
I think that the main question I get too seldom is the question about the damage that lockdown has done to us. And how will we repair that in the future?
Thank you very much, Dr. Tegnell, Lars, Saga, and also we didn't mention Cecilia, we can see her on the screen. And thank you very much for our technical support in the background. And for all of you listening in, pleasure to have you here. Sorry that we had some technical blips. And looking forward to see you on other Swedish American Chambers here in San Francisco webinars in the fall. And stay safe out there, take care of each other, and see you soon.